Well, good afternoon, everybody. It is 12 noon. We want to thank you for joining us for our August 14th Healthy Flint Research Coordinating Center's Flint Community Webinar on Coronavirus. As you can see, this is week 22, and we appreciate you so much for joining us. For those of you that are joining us for the first time, you've tuned in to this webinar that is sponsored, by the Healthy Flint Research Coordinating Center. And we are just so excited as a community core of providing leadership along with 3 academic partners, the University of Michigan, Flint, and Ann Arbor, along with Michigan State University, to be able to work together to provide this webinar for you. As we've said so often on the webinar, our goal is to provide for our community a local context to what's happening in this global pandemic. And we're finding every day new things that are happening in our community that is important for all of us to learn about. But we could not do this alone. We really needed the ability to partner with other organizations. So I am thankful to have this opportunity to host this webinar. My name is Yvonne Lewis, and I am one of the co-coordinators or directors for the community core of the Healthy Flint Research Coordinating Center. This has been a wonderful journey, and all of the partners are so greatly appreciated. Again, we have a number of community partners that have joined us and continue to join us every week. This is week 22, and we always celebrate, and we want to let you know who our partners are, even for week 22. We have a wonderful array of partners. Our banner will show that we have partners from all across the city of Flint and Genesee County. Our hospital systems have been on board. Our community health center has been on board, Hamilton Community Health Center. And each one of these organizations have provided a panelist, which we call panelist or a spokesperson, who continues to provide information. And today, we're delighted to have with us Dr. Lawrence Reynolds, continuing to be with us from the city of Flint, along with Billy Mitchell. And these persons are here to answer questions for you. So if you are interested in anything specific from any of these partners, put your question in the Q&A, and push that button for question and answer, and we will be delighted to answer it for you. We also have today one of our most recent partners from the Genesee Health System, Elizabeth Birch, who is going to be able to answer the question. Ian Robinson is back from Blue Conduit. We talked about that Flint pipe map, so all of us can know what we need to do about that. With Jim Melanowski from the Genesee Health Plan, and we also have our star. Everybody's important, but this young lady has been astronomical in our webinar and has not missed a single one, Suzanne Cooper from the Genesee County Health Department. Of course, we have information from our community schools today. They are busy getting ready for our students to return to school and are not always able to join us on the webinar, but we do have updates for you today. We appreciate having Dr. Susan Wolford from Michigan State, from the University of Michigan Flint, who's going to provide some key insights for us today, along with Dr. Deborah Verholden from Michigan State University. So we have a wide array of partners that are going to be sharing with you today. I want you to get your pencils and paper out today. This is one of those kind of sessions that you really want to write some things down. Obviously, we're taping. Those of you that are joining us by YouTube, we're glad that you joined us. But if you have a pen and paper, please jot some of this information down. But you're always welcome to go back and revisit us on YouTube so you can remember all the things that happened on this webinar today. So thank you to everyone. And I'm sure we'll have more panelists to come on. We'll let you know as they join us this afternoon. We certainly want to appreciate each one of you. As I look at those of you who have attended, some of you have been with us for 15, 16, 17 weeks consecutively. And we want to thank you for that, because without you, this would not be as viable as it is, because you're helping give us valuable information about the topics that you're interested in, but also your questions are so relevant and clearly important for the work that we're doing. Please continue to share this with the other members of our community, along with members of your family. Now, what are we going to talk about today? We had Tony Turner with us last week with the Census Bureau for the City of Flint's complete count. Tony's not able to be with us, but we do want to just kind of show you his picture. It's on the next slide. Tony Turner from the Census complete count for the City of Flint. He's a census coordinator. He got an emergency call, so he's not able to be on with us today, but we are thankful to have Dr. Reynolds on with us, who'll give us some additional information. But here's what we want you to know. If we go to that next slide, we talked to you last week about the census tracts and the wards. We just want you to know that if you know what ward you live in, if you know your census tract, we want you to encourage other members of your community, your neighborhood, to complete their census, because this is so important to every dollar that we can receive, even the representation. So the darker the space, the better we're doing with the wards. Here's the key things we want you to remember. In our next slide, we're going to show you that we're on a countdown. We only have 48 days left. The complete count will end on September 30th. We started understanding that October 30th, we would have to get everybody counted in Genesee County. We're particularly interested in the city of Flint, but all of the country is under this same pressure to get everybody counted now by September 30th. So we've got 48 days left. We mentioned to you last week that the enumerators were going to be deployed on August the 13th. Well, they got an early start. They started on August the 11th. So they've already started knocking on doors. If you haven't completed that census, you may get someone knocking on your door, encouraging you to complete the census. So we want to just make sure that we are rapidly moving forward, everyone in our community receiving a communication that they have completed their census. So I want to invite Dr. Reynolds to come into our conversation now. Dr. Reynolds, you look real professional there. I can see you. You look real professional.
Trying
ready
to catch my train. I'm not Tony Turner, but I play one on TV. The census is most important on this TV.
Yes, yes.
It's most important that you do fill out your census form, call in your census, or if someone comes to your door, answer those questions. If you want to be invisible for 10 years, don't participate. But if you want to be seen and counted, if you want to make sure we get enough support for our schools, our roads, Medicare, Medicaid, all those things, if you want representation in the House, the U.S. Senate, you must be counted. It affects everything that happens for the next 10 years in regard to government. So please, don't shirk that responsibility. You want to be counted, register and vote, but also complete that census. And as you've heard, the end of September is the end of the count. Now can I be me?
These are so critical things. Well, you are you all the time, Dr. Reynolds. You just add to the richness of the information that's being shared. I just want to, there's always so much going on in our community. Every day things are changing. We provide information on a weekly basis based upon what's happening at the time, but there are always updates and there's always some additional insights that we can provide for you. So that's again why we thank you for joining us. And Doc, you've got some real important information to share with us today.
Oh yes, and it's so important that I did bring my colleague Billy Mitchell along, who is the public health manager for the city of Flint. So I'll let her take the lead on that and carry on.
Okay. Can you hear me?
Good morning. Yes, good morning, Billy. Thanks for joining us.
You're welcome. So City Hall will be partially reopened August 19th from 9 a.m. to 1 p.m. The purpose for us opening up is because customer service is very vital to the residents. Residents like to come in and pay their water bill or their taxes. And so we've been getting a lot of feedback about that. And so the mayor decided to go ahead and open only customer service starting Wednesday, August 19th from 9 a.m. to 1 p.m. And so residents can come on in, they can go over there. Not only can they pay their water bill and their taxes, but they can also make payments for the building and inspections department too. A lot of us don't use that department, maybe like GM or other different businesses may have to come in and pay fees, but they will be able to pay those fees in customer service as well. Because we're open, the front counter, information counter will be open also pick up their water filters, their water test kits, their garbage bags, their mattress bags, whatever we offer at the information counter, they can get that then too. So
Thank you, Billy.
you're
All
welcome.
right. All right. Dr. Reynolds, tell us about what's happening with the Fast Start program. We talked about this last week. Oh, and you got some updates.
Oh, yes. The Fast Start program got off to a fast start and a lot of things happened. But now we are getting down to the wire. And that is, it's now called Get the Lead Out. And if you want your lead service line replaced, you must respond by September 18th, 2020, so that you can get your lead service line replaced for free. Now you can call, we've given you several numbers, but now I've confirmed as late as this morning that they will get you to the same place. The number I'll give you today on our announcement is 810-410-1133. You will get Row Engineering, and they will refer you to the other person, and you can leave your name, your phone number, and your address on voicemail, and they will call you back. Or you can contact Get the Lead Out at cityofflint.com, and those things will be posted. And you can mail it in if you wish. But remember, you must get this done by September 18th. If you said no before and you feel yes now, do it. If you aren't sure about your status, call and get it straightened out. So please, lead in water is poison, and we are trying to protect our children. And don't fool yourself. Adults can also have problems due to high lead levels in water and in the environment. So please call that number. You must have someone 18 years of age in the house. Getting your lawn and your sidewalk repaired is a different process and a different number. But right now, I'm trying to emphasize, get your lead service line replaced. And Billy Mitchell, is there anything else you want to add to that?
I will personally take down to Row any opt-in forms that come to City Hall. I've made it my duty to get it done because I want it to get done. I don't want any records lost. I don't want to depend on anyone else. I just want it to get to Row. So I will walk them down. It's only down the street. And I will take opt-in forms to Row myself.
And
Thank
Billy
you,
and I
Billy.
are Flintstones, so we are serious about this.
Mm-hmm.
All
Thank you,
right.
Billy. I hope our listeners understand how important it is that I asked you to have something to write with. So, Dr. Reynolds, just one more time, and we will have this up on our screen for the next few weeks so this number does not get lost to us. But for today, please give us that number again, because I have someone also, while you're thinking about that, that has a question or a statement here. I requested my lines to be replaced over a month ago through the website and have not heard anything from the city. What should they do if they requested it over a month ago and have not heard anything?
And that's why we're so glad we have Billy Mitchell here. She'll give you the number to call.
So, do you want me to give them the same number, Dr. Reynolds?
Yes. And
Okay.
if they get stuck, who should they?
Okay. 810-410-1133 is the number, but you can always call me. I don't mind. 810-237-2044.
Okay.
It's my desk
Always
number.
nice to have a name with a face.
Yep.
A face with a name, let me say it that way. All right.
Mhm.
Thank you, Billy. Dr. Reynolds, I know you've got more.
Oh, yes. Well, immunizations and vaccinations is a large topic. And first, you need to get your immunizations up to date. Secondly, you need to get your flu shot as soon as it's available, and usually that's early September. So check with your physician, the health department, or the drugstore. If you have no coverage, as Jim Malinowski told us last week, call Genesee Health Plan. If you don't know that information, you can also call the Greater Flint Health Coalition's Child Health Care Access Program. If you have an insurance card and you don't know where to go, turn that card over and look at the 800 number and call and see to what clinic or doctor you've been assigned. And then you can always go to the health department. However, let's talk about immunizations. Uh, there's been a lot of talk that we will get a vaccine for COVID-19 or SARS uh, as soon as November, October. All right. Developing a vaccine takes time. First, we have to prove that it is, number one, safe. Number two, that it is efficacious. In other words, let me break that down. It does the job. Then the other questions we have to answer is, how long does the immunity that this vaccine has engendered last? How long does it last? Remember, we've said in the past, COVID-19 is a new disease and we don't have a whole lot of experience with the virus. We hope that it will last at least months. A booster may be required. These are things that we will answer over the course of time. It may change, and we may need to change that vaccine just like we do with the influenza vaccine every year. However, a vaccine is always better than nothing. A well modeled vaccine, a vaccine that's developed over a period of time in response to the changes in response of the body or in response by the virus is most important. So this will be a developing story, just like the influenza vaccine developed and was improved over time. Now, if we want herd immunity, we can do one of two things. One, which is not so pleasant. Wait until everybody gets infected and we have about 70% of the population with immunity. That protects other people or it lowers their risk significantly. But there's a problem with that. And that is you can die if you get the disease. Number two, there are long-term effects from COVID-19 that affect the heart, the brain, the kidneys, and you don't want to take that chance. So we have to be very careful in saying, well, I don't care what happens. And then most important, you can pass it on to the people you live with, the people you work with, the people you worship with. Uh, you can pass it on to your elders. You can pass it on to infants if you don't use the proper precautions. So here we go back to problem number one. Wear your mask, wash your hands, avoid large crowds. And you've heard me say before, if you get in a situation where you thought it was cool, and then you see a crowd of unmasked people, or even more than 10 masked people that you don't know in a room, or 200, 100 people in an outside setting that you don't know, back off. And if you're uncomfortable, back off and leave. But keep that mask on. Okay, so let's talk about 2 years from now, where if 200 million people get the vaccine, that's 70% of the US population, we may reach herd immunity if nothing changes. Okay, 200 million people. That doesn't happen overnight. So we may still have to wear the masks, wash our hands, and avoid crowds. And if you hear someone telling you that we're going to have this vaccine by November, yes, there may be several vaccines by November, but we still have to test it in about 30,000 people to be sure. Why do we have to test so many people? We look at differences in ethnicity, we look at differences in age, we look at any associated medical conditions. This is the information we must gather before we tell you we already know it's safe, but we always monitor its safety, but we also want to be able to tell you if it is effective. And that takes time. So you must still continue to wear your mask, wash your hands, avoid crowds, clean surfaces that you touch frequently. And please, don't believe everything you hear. And I'll say it plain, either from the White House or your cousin Johnny, who led the latest thing on the internet that does not have much credence. If you want to know, look at the Genesee County Health Department website about vaccines, the Michigan Department of Health and Human Services website about vaccines, the Center for Disease Control website about vaccines. These are the experts who have been working on vaccines for years. And, you know, we've had some controversy, but basically, if Dr. Fauci and the people he's associated with aren't backing it, I'd check the references.
Thank you, Dr. Reynolds. That is just tremendously important for us and sets the stage for the next part of our conversation. There's so many myths. There are so many myths about vaccine, and there's so much uncertainty about vaccine. I think you cleared up some of that. And our next presenter, Dr. Susan Wolford, from University of Michigan Flint, who is a pediatrician, just loves the babies and anything that has to do with babies. She's going to give us a little bit more information about the importance of vaccinations and immunizations, because one of the things we want to do is we can't force anybody, but we can only encourage you to consider the information that's being provided for you and make the best decision for you and your family. But how do we know that some of these myths can be dispelled, and how do we know that immunizations are effective? Dr. Wolford, what are your responses to those questions?
Good afternoon, Yvonne. Thank you so much for the opportunity to share on this topic. Yes, so I think that what's important to know is that all those things that Dr. Reynolds just mentioned that need to be done in order to ensure that vaccines are safe have been done with a number of vaccines we have already for some very dangerous illnesses. And so we know that we have those safe vaccines. And I have a list of the ones here that we typically give to children. These have been tested and we know that they are safe, and we want to ensure that children are getting these vaccines so that we can protect them from the illnesses that they cause. Now, one of the things that has happened, because these vaccines are so safe and are so effective, we don't see many of these illnesses currently. But meningitis, the ones that are mainly protected by these 3 vaccines that I've highlighted, is something we still see, because for some cases we don't have vaccines that cover it. But for many causes we do. And I just want to highlight this particular illness that can be prevented by getting a vaccination or the series of vaccinations. And I'm sure we've heard about meningitis. I just want to highlight what it is. Here we see the brain of a child that's very healthy, but meningitis is an infection of that layer that covers the brain. And you get an infection that causes destruction in that area and pus to get into that area. And that can lead to death. In many cases, people will survive, but often they can survive with many sequelae, many problems down the road. One of the severe problems that children end up with is amputations as a result of having been infected. And we want to be able to protect them from this, and we know we can. So for example, one of these causes is Haemophilus influenza B. It causes meningitis. And here we see a graph of cases, and at the bottom we see by year. And if we start out, we see that the cases were fairly high. But then vaccines became available for this, and the number of cases plummet. So we know we have some effective vaccines out there, and we really want to encourage people that these are the vaccines that we should be out there making sure that we vaccinate our children, and the vaccines for adults that are available as well.
Thank you, Dr. Susan. I appreciate so much the way you display these, and hopefully those of us that are listening and have some concerns with the presentation from Dr. Reynolds and Dr. Wolford, we see the value in continuing to consider having our children vaccinated and get vaccines for adults. Our next conversation is going to center around websites, and Dr. Reynolds gave us some absolutely wonderful website references. And sometimes we hear these references and it's like, oh my goodness, how do we navigate these? So as we're getting that slide up for the Genesee County Health Department, I want to remind you that our panelists are here to answer questions for you. I do see we have some questions in the queue, but we've had some additional panelists come on board. Gary Jones is now with us, as well as Kim Van Slyke, who's going to be sharing some information with us shortly. It is just so incredibly important for us to get as much understanding as we can about this. So I'm going to ask Suzanne Kupel. Suzanne Kupel is just, as I mentioned before, one of our star panelists. And Suzanne's going to give us some insights about the health department's website today, and even some background. So Susan, you can begin. Suzanne, please forgive me. Give us insights on where we are as updates with the activities that around Corona that's happening in our community. And we're going to pledge to make sure we get your slide up. We do need to see the slide for the health department. And Tay, if you can make that happen for me, I would certainly appreciate it. Suzanne, let's talk about it.
So hello, everyone. Just a reminder that we post to our website the new data for each day at 2 p.m. So we pull the data, we do data analysis, we create charts at 10 a.m. every morning, and then by 2 p.m. in the afternoon, that information's posted to our website. So if you're tracking it and you're tuning into the website frequently, know that that's the time frame in which we make those changes during the course of our day. We try to make sure that we are providing you the most up-to-date information on our website. We review our materials regularly. You'll find on every document that we post to our website, on the bottom right-hand corner, you'll see a date. So when you are visiting our website, if you've printed something off previously and you go back and you take a new look, you'll note whether or not there's a document that's had changes, because we date every single document we post. So we want to make sure that you're aware of that. As of yesterday, we posted 2,988 positive COVID-19 test results and 272 deaths. And that is reflective, again, not of all potential cases of COVID-19 that have likely been in our community, because we did have limited testing at the beginning of the pandemic. So on our website, which is www.gchd.us, you will find our opening screen, and we don't have that quite up yet, but when we do, you'll see that we have a variety of different selections that you can make. One of the selections is for the hotline number for the state. So the state of Michigan does have a hotline number that is explicitly for COVID-19. So we're going to go to slide number 12. We can go to the next slide. So you'll see the COVID-19 hotline number was on the bottom of that screen. We can go back to the previous screen. In the middle, you'll see the COVID-19 disease button, and then you'll also see a button for those employers and schools administrators that are reporting test results, positive COVID-19 test results. That will take you to the information for doing that reporting. But if you select the second button, the one that's in the middle, we'll go to the next page, you will see that we have a very extensive coronavirus information website. And on the left-hand side of the screen, you will see all the data updates that we do every day at 2 p.m. But you'll also see buttons that are on the right-hand side of the screen. And we always talk about testing locations for COVID-19 testing and these webinars. And this is the area on our website where if you click on that COVID-19 testing locations button, you will see the list of COVID-19 locations in our community. And just a reminder, we still have the Rite Aid in Swartz Creek, the Rite Aid in the city of Flint on Clio Road. We have Hamilton Community Health Network at their North Point branch, and also at the fire station at the corner of South Saginaw and Bristol Road in Flint. We also have the Walmart Supercenter on Corona Road. We have 3 new testing locations at 3 faith-based partners that are in the works in cooperation with the Michigan Department of Health and Human Services, and they will be up and running by September. Right now, they're in the process of hiring all the staff and getting everything operational so that they will be up and running again by September. But you'll also see that on our website, we have a lot of links. We have the Michigan Department of Health and Human Services Corona's case updates. We have CDC coronavirus resources, and we also have resources in Spanish for those in our community who have Spanish as their primary language. So this is the upper portion of the COVID-19 website for our website, www.gchd.us. We're going to go to the next page, and that'll take you a little further down the coronavirus page. Okay. That's actually the front page, so we're going to go one more. Let's see where we are. There we go. So you can see at the top of the page, it says Genesee County Dashboard, and for those of you who are listening in, again, you can follow along by accessing www.gchd.us and clicking on that middle COVID-19 button. So this is where we post the information that I bring to you every Friday. Includes the number of confirmed COVID-19 cases and the testing numbers in Genesee County. But you'll also see on the right-hand side of the screen, there are additional buttons that you can click on that provide additional resources. So this Food and Community Resources button provides information about access to communities, resources for accessing food or food programs in our community. And there's a list of those there, and there's a list of food sites where you can actually get food. Under that, there's the MDHHS Certified Peer Support Specialist Warm Line. So those that are having some challenges adapting and coping with COVID-19, there are resources there to help assist you in navigating that, along with the Genesee Health System Crisis Services. So any mental health concerns that you may have, here are 2 buttons that link you to resources. Under that is the employer and worker concerns. This is for anyone that has a complaint about a long-term care facility or any one of the employers that are licensed by LARA. That's the State Licensing Bureau. There's an opportunity for you to connect and to see how you would make a complaint. We have a number of toolkits for Genesee County. We have information specifically designed for Genesee County residents. We have a business and reopening guidance for this is the employer guidance that has been updated with the latest information from Governor Whitmer. All the executive orders are listed in that guidance document, including links that if you read the executive order, you can click on it and it takes you to a link for the entire document so you can read it and review it carefully yourself. We have food service reopening information, and again, additional information in Spanish. So if we can take to the next slide. We have information that's specifically for healthcare professionals and first responders. We have information for our community partners and our faith-based organizations. We have information for the schools, colleges, and universities, and daycares. And this includes the toolkit that the Genesee County Health Department has put together for school guidance. We also have a button for American Sign Language resources. So the CDC has put together an amazing array of videos that have been done with licensed sign language interpreters to provide more information for the deaf and hard of hearing community. And all of those videos are linked in this section. And then we have lots of educational materials and specifically hand washing materials that are available that can be shared with others. And they are in English and in multiple languages. So those are another great resource. You can also see on the left-hand side of the screen the cumulative tests and number of positives in a graph form. It makes it easier for you to see that we are plateauing. And Governor Whitmer was on at 11 o'clock this morning talking about that. And again, it's because we are wearing our masks, we are social distancing, we are washing our hands and using hand sanitizers, washing frequently touched surfaces, and making sure that we are doing everything to not only take care of ourselves, but also to keep our community safe. We include the percentage of cases that are by sex, and that also includes those that have become deceased. We have our hospitalization rate. We do percentage of cases by age, and we also have by race. If we go to the next slide, we'll go through the rest of the numbers we post each day. You'll see that we could have cases by ethnicity. We have data of overall confirmed cases, and in Genesee County, the age range is 2 years to 102 years for positive COVID-19 cases. You'll see the data for overall ages for those that are deceased. And just a reminder, that age range is 27 to 102. So we want to remind everyone that young people are also at risk of death related to COVID-19. We do post information on cases by not only the city of residence, but also by the zip code. So you'll see that information's there. You'll see the frequency, that's the number of cases, and you'll also see the percentage of the total of 100 for all of Genesee County. We'll go down to the last portion of the screen. So when you click on the button that says county testing sites, go to the next slide, you'll see that we come up with the list of the drive-through testing that's currently available. Again, the Rite Aid in Swartz Creek, the Rite Aid on Clier Road in Flint, Hamilton Community Health Network at the North Point Clinic and at the Burton Fire Station, and the Walmart Super Center. That is the document that you see when you click on that button that references the testing sites on our website. Again, reminder to everyone that the latest information is posted to our website. We post daily. We review all of the documents regularly. When Governor Whitmer comes out with new executive orders, we review them, we update the materials, we update the links in all of those materials so you can actually go and see the original executive order document, and that every one of our documents also has a date on it. So you will know when it was last updated. So just a reminder also that our health department is open and ready for business. McCree South is open to the public again, and that our Burton location is open by appointment for clinic services, WIC, family planning, immunizations, and sexually transmitted infections. Reminder everybody, when you come to our building, you will get a temperature check. They will ask you some questions. If you're sick, stay home. We want to also remind everyone that this is an excellent opportunity for you to get up to date on your immunizations so that you're ready for a flu shot. And again, we're encouraging everyone to get a flu shot this fall. We're going to have 2 respiratory illnesses at the same time, COVID-19 and influenza, and getting your flu shot is an excellent way to prepare for the flu season and preventing COVID-19. Another thing that you can all do is take care of your health. Again, that's not only eating well and exercising, taking care of your physical and mental health, getting all of your preventive screenings, and that includes immunizations.
Thank you so much, Suzanne. It's just so incredibly important to have this information that you provide for us on a weekly basis. And as we've heard from some of our listeners and even from some of our panelists, it was good for us to have a review of the website, because so often we're giving the websites, but once you go on, it's a little bit difficult to navigate. So we appreciate you giving us the process and how they can navigate through the website to get the relevant information that they need. So now, in continuing that, we've had consistent questions about how are the schools reopening? What's happening with schools reopening? Well, we want to share with you, as our next slide will show you, that schools are reopening. And if you just take a look at this slide, you see X's, I mean, you see squares and shapes, colors, because each school district they've continued to make plans, but their plans are the plans for opening the schools are unique to each school district. So we want to make sure you understand today that for all of you that have children that are ready for school, please make sure you contact your local school that your children will attend to get the updated information about the processes that they will need to use. Our next slide will show you some key things that was shared with us by the Genesee Intermediate School District when they came on several months ago. I think they were one of our first participants and panelists in March when we started our webinars, and they said to us that the school districts have been planning consistently since March about how they would reopen the schools. They are utilizing the guidance that the governor has put forth in the phase plan for reopening of the state. So they're looking at each one of these phases and determining how they would open the schools. And they had to develop a plan for each one of these phases that are due actually by tomorrow. So I know that the schools are opening. They've been in the process of adapting to this new environment in which we live. We're appreciative of the Genesee County Health Department because they have put on a toolkit. And I'm going to invite Kim Van Slyke to share in this piece of the webinar with us some of the things that are happening on that school site, what's happening as they're supporting the schools and preparing to reopen safely for our children. Kim.
Hello, everyone. Hello, Yvonne. Thank you for inviting me back today. So yes, here on this screen, you can see this is on our website. You get to this the same way as Suzanne was reviewing earlier. And if you click on the button for COVID-19 information for K-12 schools, colleges, and universities and childcare programs, you will see the first button on this page is our school toolkit reopening. So we have met several times with the superintendents for the local school districts, and we have compiled this toolkit based on the CDC guidelines, based on recommendations from the state, of course, based on several of the executive orders from our governor. We combine all of that information to create the toolkit to provide our school districts with guidelines and recommendations so that they can form internal policies for which their individual districts will follow. There has been some recent discretion about our first toolkit and our second toolkit and everything. And we just want to remind everybody that it is a living document, and as things change through the CDC and as things change from the state and the governor, we do update our guidelines to reflect those changes that are being made. So as soon as we get those changes, we put them into place into the toolkit and make it available for you and update it here on the website. So pay attention when you open the toolkit. It does give you a revision date so that you know when the most recent revision was. Some of the things that it talks about, it gives a lot of scenarios for what happens if there's a child who tests positive, what happens if there's a teacher who tests positive. Everything, just like in our individual lives, everything revolves around whether or not those districts are able to maintain that 6-foot distance. And if kids or teachers are within 6 feet for greater than 15 minutes of a positive case, then anybody who falls into that definition must be quarantined. So when the schools find out about a positive case, or if we find out about it first, then we contact each other and they will close down the classroom that it's affected so that the classroom can be cleaned and disinfected. During that time, we will work together to identify who those close contacts should be. The school plays an integral part in that because we need their eyes and ears to be able to identify who the kids are sitting with, who the kids are walking with and talking with. They have seating charts for their buses if they have buses. And so then they're going to help put together a list of contacts so that we here at the health department can then make first contact with anyone who needs to quarantine and give them the information that they need to understand what is required for quarantining. Once they've been contacted, they will then get put into the same contact tracing program that we use for the rest of our contacts. Because it's a school and because we want it to be expedited, we are making first contact for the schools, which is unusual or out of the norm of our usual case investigation. But we are trying to keep the schools open and keep the kids in school as much as possible. The other piece that we are helping and working towards to help keep the schools open is, I don't know if you remember back probably at the beginning of one of my first visits here, we mentioned a task force that was focused on long-term care facilities and assisted living facilities. Well, now those facilities are very practiced at what they're doing and they have things well under control and they don't need as much help from us. So we are transitioning that task force to now include the schools, and we are also bringing on more people. We've just, if you haven't heard the announcement, it was passed by the board that we have several positions approved. So we are adding people to that task force as well, so that each school district will have a nurse or a pair of nurses from the health department here that they will be able to contact for information on how to handle a positive case, how to handle a quarantine, who gets to return to school, any type of questions that should come up. They will have several direct lines to us because they already have my number, they already have our emergency number, they have the number for our epidemiologist, and now they'll also have this sort of case manager assigned from our school task force to be able to help them manage what's going on in their schools and to answer any questions for them.
So Kim, may I ask you, is this the communicable disease nurse that you're speaking of now?
They are communicable disease nurses, some of our full-time staff, and we also have a very large, robust part-time staff here at the health department who exist of the majority of them are former employees who have worked in our communicable disease process before, and some of them also are local school nurses who've retired from school nursing. So they have a strong public health background all the way around. So we're really excited to be working with all of them.
Thank you. And we could just go to our next slide. We just want to reemphasize the website again for everybody to see. Again, take it down if you're looking right now, and you can write that website down. For those of you that have joined us by YouTube, please feel free to go back and look at the webinar again, get this information down. For those of you that are listening, it is Genesee County, gchd.us/information for schools with hyphens between information-for-schools /. And the reason we wanted to bring this to you today is because, again, in this toolkit, there's great information, but also I wanted Kim to spend a little bit of time. I mentioned a communicable disease nurse because this is something you're adding to, even though it isn't in the toolkit online, it is in the toolkit of resources that the schools will be able to utilize. So if you could talk a little bit about that.
I'm sorry, you broke
Stay
up.
on that side, please. The previous slide.
I'm
Okay.
talking about the contact tracing.
Communicable disease, and yes, and
Oh,
the contact tracing.
Communicable diseases is a program here at the health department that takes care of all communicable diseases, flu, pertussis, TB, anything that is considered a communicable disease by the CDC. And they specialize in these disease processes. And all of our nurses have, during this COVID time, whether they were a CD nurse or not, have been trained in communicable diseases to a vast extent, because it is a part of what we do as nurses. But the specialty nurses in the communicable disease department do receive extended training related to different diseases. Unfortunately, as we all know, we don't have a lot of background on COVID, but the actual process doesn't differ from how we would investigate a foodborne illness or a TB case or a pertussis case. We do the same background information, the same contact tracing, the same communication and education that we can with the family and any of the contacts.
Thank you. One other thing we wanted to just share with our families today, because we're talking to parents, grandparents, community health workers, navigators, and we've talked about our community testing sites that will be coming up. And this is very important for our children, because they're going to be providing these mouth swabs for children during these community testing sites events. So even when children are asymptomatic, they will also be able to get these, get their testing done. Is that correct, Kim?
That is correct. They are community testing sites, similar to the sites that we have held with the Michigan National Guard. They will not need appointments or doctor's notes, and they will be able to come and get tested. Suzanne is really the specialist in this department. She's the one that puts all of this together, but she has shared the information that once our community testing sites are open, we will have testing available 6 days a week is the plan.
Thank you. And one of the
And
things we
at
wanted to
varying hours. This is Suzanne. We're trying to make sure that the testing is as accessible to everyone as is possible. And we will also be able to accommodate those with other languages and anyone that has uses American Sign Language. So there's a lot of legwork that's going into making sure these sites are set up to accommodate everyone.
Thank you, Suzanne, and thank you, Kim. Just one more reminder, as Dr. Reynolds has pointed out, Dr. Wolford has pointed out, and Suzanne, even you pointed out, based upon the documentation and the data that we have, our children are not immune from this virus. They have the potential to becoming infected as well. So we want to be sure to take care of our children and get them tested. As we move forward, we'll close out our conversation around the schools. Flint schools and Genesee Intermediate School Districts are still available to you. And on this next slide, we just want to remind you, for the Flint Community Schools, they did open this week. And they are asking you, if you want to get a child in school, the numbers are here for you to call. If you want to get your child in school, you need to call 810-767-6158. Or if you have general information about what's going on in the schools, you can call them at 760-1000. For the Flint Community Schools, a quick flash, if you didn't see the news yesterday, today is the last day that you can request laptops or hotspots for your students. So all of you community health workers, family members, anyone on this webinar today, as soon as we're done, have your families that did not get that contact made about a hotspot or a laptop for their student who is in a Flint Community School, please call them. Tell them today is the day, August 14th, that they must request their technology, the laptop or the device, the hotspot. Call 760-1000. Thank you so much for helping us get this word out. Gary Jones, as we often want to hear, what's happening from the state level? Gary,
Sorry, Yvonne. Yeah. was looking for the mute button actually. So I
The
am
unmute button. Okay, I'm gonna talk a little bit longer so you can find it next time.
I am actually like in the car right now. I'm sorry. I thought I was going to be like at home by the time you got to me.
Okay.
And so
Well,
what
be safe out there.
the governor did have a press conference actually this morning. I was just about to push out the update to everyone. So if anyone is interested in sort of getting the brief on, you know, what it is that she discussed, please feel free. I think my contact information, I know Yvonne usually do a good job of putting that up, but feel free to send me an email. I can make sure that, you know, once I get home, you know, to push out this email update, and so everyone can get the presentation from this morning's press conference. So I know I usually have a more robust update, but like I said, my apologies. I'm in transit right now.
That's okay, Gary. We want you to be safe, so you drive carefully. We will share, yes, on the screen with your wonderful picture, the number, your number, 517-282-3193. And for those of you that like to get the daily updates from Gary Jones, his email is jonesg like Gary 9@michigan.gov. And certainly he will be diligent about getting the information out to you. Thank you so much, Gary. And again, be safe in your driving. Dr. Deborah Verholden is always on task with us, always available to give us those salient points as we close out our webinars on a weekly basis. Dr. Deborah, you always have great insights for us. Please share with us the updates that you have for us as a representative of Michigan Corona Task Force on Racial Disparities and the Greater Flint Corona Task Force on Racial Inequity. Okay, I know she was having some technical difficulties. All right. Okay. Well, let me just go forward and remind you all, these are things that have been discussed before. We want to remind you, it is important that we continue to wash our hands and so that we can be safe. This is one of the universal precautions that we were taught when we were young children. Let's continue to teach our children that. Use our PPE, as Dr. Reynolds said, put that mask on, cover nose and mouth, and be safe. Let's continue to practice social distancing. As you have heard, we have reduced the number of cases in our area, and that is because we have participation from a large number of our residents who are following these practices. Let's continue to eat well, boost our immune systems, get a good diet of a good high nutrient diet, and do some exercise every day, even if it's out cleaning your yard. And of course, get enough rest. Let's clean our surfaces regularly, get tested. It's wonderful that we have all these test sites here in our community that allow us the opportunity to get tested. Now, I do understand that it takes us a little while to get the test results back. And you can believe me, there are many in our community, communities that are addressing this issue to make sure that we can find a way to get our test results more quickly, but it does not negate the fact that we need to get tested. And let's continue to get both primary and preventive care. These are just some critical things that we need to think about on a regular basis. Don't let these things keep us from doing what we need to do to be a healthy community. I want to remind you of a couple of things. 3 things we want to leave you with today. Stay safe and honor the protocols. You're responsible for your own health, yes, but you are also responsible for helping others be safe as well. So wear that mask and to keep distancing. Let's complete the census. We have 48 days left. Let's get our census done. Go to 2020census.gov. If you've lost that form, you can call or you can go to the website and they will help you walk through that process. There are a number of groups that have been funded to help us within our community to get our complete count. And of course, register to vote. Your voice does count because you're an important person in our community. You count as well. You count every week when you join us on this webinar. So we want to appreciate you for joining us today. And we invite you to complete the pop-up survey that will follow this. Like us on Facebook at Healthy Flint Research Coordinating Center. Subscribe to our YouTube channel, Healthy Flint, And of course, you can always email us at info@healthyflint.org. I certainly have been privileged to have this opportunity for now to sit and chat with you and our community members. Don't forget that survey. Please think about joining us next week, August 21st, because we'll be here. Next week, we'll hear more about the Neurodevelopment Center of Excellence that we have in our community. Again, thank you for joining us, and we'll look forward to having conversation with you on the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Have a wonderful week.